This is Lauren again, and I have back with me Dr. James Moises. After our last recording, there was so much more we wanted to talk about, so we decided to schedule another episode. So here we are again. Thanks for being here.
It's great to be back with you again, Lauren. Thanks for having me.
Okay, so we're going to talk about I guess you would call it conventional medical system and why we are not practicing in that system. So I just want to hear from you, like what led up to that exit for you?
Sure. So, I've been practicing a little longer than you. It's been about 30
Yeah.
years from when I started medical school to where I'm at now. And it's fascinating how the entire healthcare industry has changed. I mean, when I started, that's when HMOs came in and went out all within a few years because it just didn't work.
Mm-hmm.
But in the last 10 years, I find the biggest problem with medicine is not only the consolidation, because sometimes that happens, but it's just essentially the corporate takeover of medicine.
Yeah.
And they treat patients like a commodity is really how I see it.
Yep.
Having worked for a lot of big corporate healthcare providers, hospitals, HCA being the biggest, for instance, and they're for profit. At least they don't try to hide it.
Yeah.
um, at the end of the day, it's about how can they make more money and make sure they're profitable.
Mm-hmm.
And that most of them are nonprofits, so they don't have shareholders. But the few that are out there that are for profit do have to answer their shareholders.
Right.
And that's why this system doesn't work. It's why we're the only country that does it. Healthcare, whether you want to argue is it a right or not a right, is a whole different story.
Yeah.
We're talking mainly about, what happens when you walk in the door of a hospital,
Mm-hmm.
and do we do everything for the patient, um, or do we do everything for the bottom line so that the administration can make more money at the end of the year?
Yeah.
So my exit from the hospital situation was about 6 years ago, right before COVID. So it ended up being good timing. Not that
Very
I
good
wouldn't
timing.
have minded. Well, and I would have been fine taking care of all the sick people.
Yeah.
What I would have absolutely had to have left the hospital system, simply because what was going on in the hospital system during COVID. I
Yeah.
mean, as you remember, nobody was allowed. We had hundreds of staff and nurses and doctors coming and going, but this
Mm-hmm.
blanket statement of no families allowed in the hospital made it for really a lot of bad stuff going on in these hospitals that nobody was able to witness. And
Yeah.
I know that for a fact. And so there's no way I could have been a part of that,
Yeah.
where they let people die that they thought was too old or too sick or they were too busy. That's what happens in a pandemic. Hospitals
Yep.
get overloaded and then bad things happen,
Yep.
whether it's a baby or an adult.
Mm-hmm.
And um, so I'm glad I was out before that. I would have definitely left during COVID,
Yeah.
but I left because with the corporate takeover, it really comes down to spreadsheets and productivity and billing as high as you can bill.
Mm-hmm.
And nobody really cares about patient outcomes. And we even see that in commercials in the local market.
Yeah.
They love to advertise how many thousands of patients they see, but they never talk about how their outcomes are some of the best. And
Right.
in this market and in Louisiana and New Orleans, we remain the worst in terms of outcomes and in the whole country. It's
Yep.
a problem. It's a
It's a
sad
big
problem.
problem. So how was it affecting, like, if you have to, like your day-to-day work, like actually taking care of each patient, what were you experiencing?
So where I trained at a charity hospital, which is now closed, I stayed there because it was one of the busiest ERs in the country at the time that I
Mm.
trained there in the mid 90s. Us and LA County and Bellevue and all the big traditional inner city hospitals, they're busy. But we trained there because it was good training and we took care of sick people. So in terms of me being able to handle the fast pace and a lot of patients, I was prepared for all that. what
Mhm.
happened with the more corporate takeover was a lot of stuff that I thought was just completely unethical and I think even illegal.
Yeah.
So, for instance, they started something where it's uh, regarding reimbursement and everything else. They started tracking this thing called uh, uh, door to doctor time. Like, how fast
Mhm.
can you see a patient when you show up?
Right.
And that's good. I think they should look at that to see that we're not making people wait longer than they should. The
Right.
problem was they weren't genuine with it. And this is
Mhm.
just one example. So they would have the ER doctor who's on duty walk out to the waiting room, look at all the patients, and then they would officially say that the doctor has seen the patient. So the clock
Wow.
would start. And then they would have some triage nurse just order a whole bunch of lab tests. And the patient still may not see the doctor for maybe 6 hours.
Wow.
But at that point, they still have it logged that the doctor saw the patient, which means then all those tests that the triage nurse ordered, they would still bill the insurance company or Medicare or Medicaid or even the patient because it's documented that the doctor saw the patient. And then they would
Wow.
require us to sign a piece of paper. Patient left early, but they wanted us to sign that we evaluated the patient, which is
Ugh.
just grossly not only illegal, it's unethical and it's
Yeah.
wrong.
Yeah. That's awful.
And that's when I said I'm out. Sadly, a lot of my colleagues signed that because they get paid a lot of money, especially the medical directors. And that's what goes on even today. That's why it shows if you go to the emergency room, the wait time is only 10 minutes. No, it isn't. It's still 3 hours, but it's 10 minutes before somebody looks at you or maybe says, "What's your problem?" And then they talk to you for 30 seconds and that's it.
Right.
And you're still waiting hours in the waiting room, in a chair, if you're sick. So, from an emergency room standpoint, it's just grotesque what they've done. And they don't care about people, sick
Right.
people who are hurting. And that happens in the emergency rooms in the New Orleans area and across the country all the time. So
Wow. I didn't even know that that was a thing. I did not know that.
most people don't. Um, this is the stuff that corporate medicine does. They never put it in writing. So
Mhm.
they've learned from corporate medicine, the CEO and all the top administrators never, ever, ever communicate with the doctors, at ground level.
Yeah.
It always goes through the directors. And that way, if anything, you know, uh, doesn't work out, it's not that it came from them, it came from the medical directors. It's just corporate
Right.
medicine. You have to have layers to protect yourself.
Right.
And like I said, the biggest problem I had is nobody really cared about the outcome of the patient.
Right.
And especially in Louisiana, I think the biggest problem is that we have a 50-year-old medical malpractice cap of $500,000.
Mhm.
And sadly, hospitals know that. Now, 50 years ago, revenue was way less than what it is now.
Yeah.
Hospital costs are soaring.
Yeah.
So these days, a hospital, all the big hospitals in this city, will make $500,000 in about 1 hour. That's their gross income. That's how
Wow.
much money they're making. It's crazy.
Wow. After they cover
So
expenses.
it's before, well, after,
Oh, that's gross.
before,
Okay.
regardless, it's still a crazy amount of
Yeah.
money that they're
Uh-huh.
billing out.
Mhm.
And so my opinion is that they just roll the dice because they say, you know what? We'll take our chances. If something bad happens, we know maybe 50% or whatever is going to actually pursue a lawsuit. And of those 50%, we might beat them down where they just walk away.
Right.
But worst case, if we lose, it's only going to cost us $500,000. And when they're making $1 to $2 billion a year, they just don't care about patient outcomes.
Right.
And I see that by who they hire. It's more about just putting white coats on everybody rather than really doing due diligence. In Louisiana, it's a problem. That's why I refer a lot of people for surgical procedures and stuff outside of the state.
Yeah.
Not that there aren't good surgeons here and good doctors here, there are. but the systems of the two companies that run the hospitals here are fundamentally broken and driven by greed.
Yep.
Bottom line.
Yep.
Bottom line. And that's why I tell everybody there's no safe hospital in this city to go to.
I know. It's
None.
so sad. I mean, that's the same in my line of work, like when people need to go to a psychiatric hospital, or when people think they need to go to a psychiatric hospital, and maybe they really don't meet criteria, I'm very honest with them that like this is not going to be like this is not going to some rehab in Malibu on the shore and you're going to be relaxing in a spa. Like this is not a place you want to be unless you absolutely 100% need to be there. And if you think that you need just a higher level of care, but it's not that acute, like we got to send you somewhere outside of the state.
Isn't
It's
it
sad.
sad? And
It's
what's
really sad.
interesting though, people listening to us talk would say, well, that's the way it should be. You shouldn't have to go to a hospital unless you absolutely positively need it. Medicine isn't so black and white and so cut
No.
and dry. Sometimes we don't know. And that's
Right.
why sometimes, whether it's for mental health or for chest pain or for belly pain, sometimes we don't know if it's in the early stages where it's going to get worse in 24 hours.
Right.
And
Right.
so that's where, you may need inpatient facilities to not make things worse, to just see, and that's good medicine. And we
Yep.
can't do that kind of good medicine anymore. We roll
Nope.
the dice outside now rather than inside. And then
Right.
we're behind the ball. Yeah, I'm sure with your depressed patients who might be on the fence, it might have been easier to watch them because they're on the fence, but you're right. You put them in, and then it can make things worse, and
Yep.
it's a problem.
It's a
People
big
don't
problem.
realize that. They don't
No,
realize that.
they don't. They don't. And it's something you really only know if you've been in a hospital like that or you've worked in a hospital like that and you've seen what it looks like on the inside. Otherwise, you don't know. So,
Yeah, and they
something I
let
wanted to
people. Okay, I was just going to finish off by saying, you know, and unlike COVID, now they let family in, but they greatly restrict how much access, and if you ask too many questions, then they want you to leave, and it's a
Mhm.
problem. It's a
Yeah.
problem. They should be proud of offering good care rather than trying to hide up bad care. And that's, in my opinion, what happens in most hospitals. Like I said, there's good doctors and nurses, but because the systems are bad, it's more about the corporations putting policy in place to cover up the bad medicine they're doing rather than to promote the good medicine. And that's a
Right.
problem.
Right. Right. So this is like a connected conversation to what we've been talking about, but I'm assuming when you went through this like corporate takeover of the hospital that you were working in, that there was also a big increase in the amount of like administrative work that you had to do, like with charting and documenting and all that. And that, we know leads to a lot of physician burnout. And I'm pretty sure the ER has the highest rate of physician burnout out of all specialties. Is that right?
It's gotten worse. I'm not sure. I mean, I know the trend is back to where a lot of emergency physicians are leaving the specialty. A big
Yeah.
part of that is, EMRs, electronic medical records. That
Mhm.
started about 15 years ago and really took hold in around 2013ish or so. And the problem with electronic medical records, everybody likes to make it sound like it improves, patient outcomes or it improves healthcare. It really doesn't.
Yeah.
For the simple fact that it's really a system put into place by hospitals for two things, I think. Number one, to increase billing,
Yep.
and number two, um, to sort of cover their butt because you
Mhm.
got to check a lot of boxes, even if you didn't do it.
Yep.
And then if something bad happens, they can say, "Well, no, all that was addressed, and the patient didn't have any of that." So it's a document that protects hospitals when bad things happen, but definitely drives the billing way up
Yep.
because the more boxes you check, the higher you can bill.
Yep.
And but it does nothing for patient care. I
Mm-mm.
mean, the last I read, it was, doctors, and I was doing this for real. 80% of your time on a shift was behind a computer. doing all that
Wow.
stuff, and 20% was actually in front of the patient.
Wow.
Um, because everything you had to do, they made it to where even ordering anything, nothing, the verbals, all that, they'll say it was safer, and some of that might be a little safer, but it's still too complicated, and it didn't help patient care. It
Yeah.
definitely it caused doctor burnout, and a
Yeah.
lot of my colleagues retired very young, early 50s, and they were good doctors, but they said this isn't what I signed up for, and it's
Right.
unfortunate. It's
It is
unfortunate.
really unfortunate. And I don't know if this is as much an issue in the ER, but I think part of the problem that came with electronic medical records was like this expectation for constant access to the doctors. Um, so I know in like a lot of other specialties, and I would assume this happens some in the ER, that when these like patient portals are built into the electronic medical record, there somehow it's like this like shift in the patient's mind that like, oh, if there's a patient portal, I can message anytime of day, any day of the week, and like get access to my doctor. And so doctors have lost the ability to like step away from work and be with their family or recharge or relax or whatever they used to do in their free time. I know that this is like a constant problem in my practice and private practice. Like there is never a day where I'm not communicating with a patient ever.
So I wasn't aware. I mean, I left, I guess, before the patient portal thing started to take effect. So you mean because the patients have access to their records, that means they also have access to you when they have a
Yeah.
question?
Yep.
That just doesn't work. That can't be.
No.
It's not like you're just sitting around waiting for patients to go on a portal. I mean, yeah. Wow, that's horrible. I mean,
Yeah.
it's
Well, and it's kind of like, I think the problem is when you're messaging on a portal, people think of it as like texting, and it's like there's an expectation for an immediate response. And when people don't get an immediate response, they get very upset. But they don't realize like, the doctor's working. A lot of these times it's like the doctor is seeing 20 patients or something and like their
yeah.
whole day is stacked and they kind of forget like how many other patients are messaging, you know? So I actually have a patient who's an ER doctor, and I think he goes above and beyond what is in his job description just because he's a good person. But he is answering portal requests from patients he saw in the ER like long after his shift has ended, which is so outside of y'all's scope of practice.
Well, it doesn't make any sense. The other problem is that all should be addressed when the patient's with you. But I understand
Yep.
they may have other questions later on, and that's where maybe an email will suffice. And then when you
Mm-hmm.
get to it, you can respond to it. But the fact that people, this is, I'm not, I'm all for people having access to their medical records. But the
Yeah.
problem is 99.9% of people who look at their medical records don't understand that.
Right.
So if they look at a lab result or a CAT scan result and they see something that's not saying that you're the greatest person in the world, then they're going to think, oh, something's wrong, when maybe
Right.
nothing's really wrong.
Right.
Um, and so it causes fear. So the problem with too much information to people who don't know how to read it is it causes more anxiety.
Yep.
And I don't think anybody benefits. Again, the corporations, the CEOs love this because they're not answering portal requests. They
Mm-hmm.
want to tell everybody, look, you have access to your doctor whenever you need them because they're not answering those portal requests.
Exactly.
This is a detachment from corporate America to what people do who really make a difference in this world. And
Yep.
I don't care for hospital administrators because they really don't care if people live or die. And so as a result, they put doctors in a bad position. And if we had a system that was more like the rest of the world,
Mm-hmm.
then you wouldn't have people making these horrible decisions, not only for doctors and people who treat patients in the hospital, but these horrible decisions, in my opinion, for patients as well. They just
Yep.
add more chaos and more anxiety rather than making the system better.
Right.
And
Yep.
it needs to be scratched and kind of restart all over again to a little bit like what we used to do before.
Mhm.
And but I wasn't aware of the portal. Wow,
Oh, yeah, and, like,
that's
people don't
just crazy.
realize, you know, your doctor is not getting paid for any of that. Like, the time that they're spending to respond to your message and the 100 other messages they get that day, they're not getting paid for that. The hospital is getting to look great because they get to say, like, "Oh, these doctors are available all the time. You can access your doctor whenever you want," you know, so they're more appealing to a patient, but the doctor is not getting paid for any of that.
Well, what's interesting too is in the emergency room, and I'm sure it's throughout the whole hospital. What a lot, since most doctors are employees now of hospitals,
Yeah.
what most patients don't realize is the way they kind of withhold reimbursement for doctors is a lot of it is based on patient satisfaction.
Yep.
So unless you have a 95% patient satisfaction, all of a sudden, if they're guaranteeing you, let's say, $1,000 a day, they'll say, well, your patient satisfaction is only 80%, so we're only going to give you $700 a day. And that's the
Mhm.
reality. So with this portal thing, it's a great way for hospital administrators to say, oh, you didn't answer patients fast enough, so we're going to have to dock part of your pay. And that's
Yep.
what really happens.
Yep.
And the patients, poor patients, I mean, they just want to have a question answered.
Yeah.
But the hospitals set this system up and they do it for a reason. And it has to do
Mhm.
with docking doctors' pay. They do it all the time.
Yep.
And this is what I mean. This is the problem with corporate medicine. They don't have board meetings to say, how can we make a first priority to make sure doctors have a environment where they can be really good doctors, but also where patients really get the care they need.
Yep.
Instead, they look at how can we make more money? How can we order more tests? How can we cut costs by hiring less qualified people? And that's
Mhm.
what they do. And they get away with it because nobody ever holds them accountable.
Right.
The good hospitals in this country do that. And there's a lot of good hospitals in this country. I'm talking mainly from my experience in South Louisiana, where they just don't care.
Yeah.
And it sounds like an opinion of personal opinion. I base that on the fact that Louisiana ranks the lowest in healthcare in the
Yep.
country for more than 10 years, probably running. So
Yeah.
it's not just me having an opinion about hospital administrators. It's the fact that independent observers say your hospitals are horrible,
Yep. Yeah.
but nobody holds them accountable.
I
And
know.
and the patients suffer, which is sad.
It's very sad. It's very sad. And I think it just makes it a really um unappealing in working environment for doctors. I mean, it's just you're not I think in New Orleans, especially New Orleans is lucky that there's a lot of people who are from New Orleans and want to stay in New Orleans just because it's New Orleans. But it's hard to attract doctors from out of state, good doctors with the system that we have. I mean, it's so unappealing.
Yeah. And to our the listeners out there might be saying, "Oh, these two doctors, they just want to work 20 hours a week and get
Uh,
paid a whole lot of money." That's not
uh-huh.
what we're saying.
Nope.
We're happy to take care of a lot of patients and work really
Yeah.
hard. They
Yeah.
just don't understand the circumstances and the conditions that these hospitals put doctors under. It's not feasible, it's not fair, it's just wrong.
Yeah.
And they feel like, you know what? Either you play by our rules or you're replaceable. And oh,
Mhm.
by the way, we own almost all the hospitals in the city. So if you don't work for us at this hospital, you're not going to work anywhere else in the city. So I guess you have to move.
Yep.
And that's the problem with a monopoly, with two companies that own all the hospitals in this region. And that's what they do. And
Yep.
that's how they really go after doctors and nurses and everyone else. They say it's on our terms, whether you like it or not. And if you don't like it, you're not going to work in the city.
Right.
And that's just horrible,
Yep.
horrible.
Yeah, well, and it just like, you know, being in a system like that, it's like at some point you're forced to practice in a way that you know is not aligned with the way you were trained and like the reason why you wanted to become a doctor in the first place. I mean, all of us could have, you know, been in other professions, used our knowledge to be in other professions that probably made a lot more money and were a lot easier. You know, we everyone who becomes a doctor wants to help people. I mean, there's
Yeah.
no other reason to go into medicine unless you want to help people. And unfortunately, a lot of these systems are set up so that like that is not you're not able to have that as your primary focus. You're just helping someone just for the sake of helping them. That's it. That's all we want to do.
And I'm glad you brought that up because it's so true. That's why we train for 8, 9, 10 years,
Yep.
because we know how to take care of sick people,
Mhm.
whatever that sickness or illness is. It's all the other stuff that gets in the way.
Yep.
But I love, not that I love people to be sick, but I love having an opportunity to take care of someone who's sick, just
Yep.
like you do, because we know how to treat them.
Yep.
We know how to diagnose. We know how to treat. Sometimes it takes more time than we would like, but we know what we're doing. It's the stuff that these hospitals are putting on us, the extraneous stuff that makes it impossible for us to do what we got into the business for, which is helping
Yep.
people, helping sick people.
Yep.
And it used to not be that way. And like I said, I've been in it for 30 years now. And, the busier we were, the more people we took care of, the happier I was, because 100% of my efforts was going into taking care of sick people.
Yep.
And that changed completely, where only 20% of my time was going taking care of sick people, and the other 80% was pleasing hospital administration,
Yep.
for billing purposes usually. And that's sad. I don't know how it goes back the other way. Um, but
I know. So that's that was going to be my next question is like, what do you think? What do you think it would take to? I don't know if you could ever get back to where we were, but get to a better place than we are in now.
the single most thing I think we could do, and it's a problem just with this country, is we just need to take the greed out of healthcare. I mean,
Yeah.
the fact that the CEO of these hospitals are making 2, 3, 4, $5 million a year
Oh my gosh.
just as an administrator,
Yeah.
and all the people underneath them are making half of that.
At
Um,
best.
it shows where their focus is.
Yeah.
So until we take the greed out of it, which is why a lot of people get into healthcare, non-physicians
Yep.
and non-nurses and non-therapists. Um, People see that there's so much money from insurance and Medicare and Medicaid being paid at these crazy rates. That's why these people get into it, to exploit it. When you
Yeah.
take that greed out, then it falls back between doctor and patient, and we get to
Yep.
do what we want to do. And I really
Yeah.
think that's it. You have to take the incredible amount of profit that all these hospitals are making, and they're all going to lie and say they're losing money. They're all nonprofits run as corporations,
Mhm.
and they know how to just spread the numbers around to look like they're not making money.
Yep.
And even when they do make money, they don't pay taxes because they're a nonprofit.
Mhm.
It's the perfect scam. They get away with stealing so much,
Yeah.
acting as a nonprofit. No property tax, no tax on anything. And the bigger they get, then when you push too hard, we've seen this before in the past, if you expose and push too hard to these hospitals, they say, well, we employ 3,000 people. And if we fold or close, all those people are going to be out of work. So
Uh-huh.
they use this guilt trip that we're too big to fail. So you need to give us whatever we want,
Yeah.
which means let our executives make millions of dollars.
Yep.
And then they follow that up with these fundraisers. I'm like, wait a minute. You're paying millions and then you're claiming you need more money in fundraisers.
Mhm.
It doesn't make any sense.
Yep.
And it's going to burst at some point. It just can't go on anymore, I think.
No.
And so finally, there's some people in Washington talking about it. But when we take the greed out, which means you take these crazy profits out, then things may start to change.
Yeah. Yeah. Well, I hope that happens at some point in my career.
Yeah. But in the meantime, you and I and a lot of other good colleagues, we're there when people are sick and we take
Yeah.
care of them. And, you and I are fortunate because we don't answer to any corporate entity.
Nope.
That's why I still love what I do.
Mhm.
But yeah, I wish the broader spectrum of healthcare could do what we do, and
I know.
unfortunately, it's not the case.
I know. It's I always like I'm trying to recruit my psychiatry friends to the dark side, and like it's just so great being able to just like take care of people, and that's like what I'm focused on. It's
Yeah,
and I don't have
good
to
for you.
answer to anybody. So
Good for you.
um well, thank you for coming back on. It was fun to talk about, even though it's kind of scary and serious conversation, but it's good to, talk to somebody who's also on the outside, because then we can talk smack about these systems and not get in trouble for it. So,
Great. Exactly. Invite me back
um,
anytime. I love chatting with you. This is a great forum. So thank you.
all right. Well, thank you. Thank you for tuning in to this episode of the Little Brain Campaign podcast. If you enjoyed our conversation, give us a follow on your favorite podcast platform so you never miss an episode. Please take a moment to leave a review while you're still thinking about it. It really helps grow the podcast, and I love hearing from our listeners. See you next time.